Okay, so what's the criteria we use to discern a junctional escape rhythm on our ECG tracing? First, look at the P wave. You won't have one. And if you do have one, it will always be inverted. This inverted P wave may appear before the QRS or after the QRS, or if it gets glopped up within the QRS, there will be no P wave. Next, the QRS should be normal. Again, the conduction is originating at the AV node and taking a normal path through the ventricles, which should produce a normal narrow QRS. Next, the rate. The inherent firing rate of the AV node is between 40 to 60 beats a minute. So narrow complex, no P wave, a rate between 40 to 60 per minute, junctional escape. I'm Mark, thanks for watching. See you in the next video.